Together, we can advance treatment, improve quality of life, and strengthen hope for the future. To our neurologists and professionally health caregivers, thank you for your dedication and tireless efforts in advancing research and care. And to our patients and caregivers, your courage and resilience inspire us all. Your stories remind us that Parkinson's is not just a medical condition, but a human journey that requires a compassion, understanding, and solidarity. Let us use this opportunity to learn from
شكرا جزيلا. السلام عليكم ورحمة الله وبركاته. At the beginning I will just welcome our guests in Arabic who is our Arabic speakers. السلام عليكم ورحمة الله وبركاته. أصحاب المعالي والسعادة الحضور. حدث اليوم ليس حدث علمي عادي، بل يمثل حدث مميز، انطلاق المؤتمر الأول البحريني لأمراض اضطرابات الحركة والباركنسون، والذي استضافت إمارة دبي هذا المؤتمر لأربع مرات سابقة في الأعوام السابقة، والسنة دي هي السنة الخامسة اللي بنستضيف فيها المؤتمر هنا. ويتميز المؤتمر في نسخته هذا العام بدمج حدثين رئيسيين يتمثلان في عرض مستجدات التشخيص والعلاجات الدوائية والتداخلية في مجال اضطرابات الحركة، كما يحتضن المؤتمر أول عيادة توعوية مجانية لمرضى الباركنسون وورش العمل المختلفة. Thank you. Now we are going to today we are going to talk about we'll start with the unmet needs for Parkinson disorders. So we are talking about Bahrain Parkinson landscape of our unmet needs. This is our beautiful Bahrain. I invite you to have wonderful time in our beautiful kingdom, perhaps after the scientific event. And Bahrain is a small country. It has about 1.5 million population, and half of the population is expats, and half is of Bahraini origin. And you know that there is aging population nowadays, and this increases the number of Parkinsonian patients. And in brief, I will not talk scientifically. So Parkinson disorder or Parkinson disease is a chronic progressive disease which is disabling with time, and it's characterized by decreased motions, by rigidity, by tremors, and even sometimes with cognitive and behavioral changes. So this picture is showing us since our childhood, then until we reach to become in a Parkinsonian feature. But actually this is the normal aging, but you will see it more rapid, progressive in Parkinsonian patients, and it carries more disability. So it is noted that the number of Parkinsonian patients or prevalence of Parkinson has much increased because of the aging population, because of the improved health care actually. So patients are higher age, okay, and it is affecting men more than women. But here in Bahrain, especially, as before it was with Dubai. So when Dr. Vinod started his program in UAE, it was mentioned that we don't have Parkinsonian patients. Our population is young population, most of people, because of the number of expats. But due to the rigorous and continuous efforts, he could have achieved greater results of detecting patients who were not known to be Parkinsonian patients. We need to provide and to help the unmet needs for our patients. So one of the most important things for the unmet needs, we need to improve our motor symptoms for the patients. The non-motor symptoms, which are early happening and they are not easily detected, then most of those symptoms are attributed by us, even if we have doctors in the family, to aging process. Aging process usually does not carry disability, okay? So another thing is the cognitive treatment, the curative or disease-modifying agents that is not yet out, but it is in the pipeline. Biomarkers, it's very important to detect something, to early detect the Parkinson's disorder, especially in families where there is prevalent Parkinson and even neurodegenerative disorders. And to get a grading system which could help us to establish the severity and of the treatment. Now, actually, I want to just highlight that amongst us, you may stand up, Dr. Zainab Saloom. Okay, so Dr. Zainab Saloom is an NET doctor. He just came, stay standing up. So she just came from Spain, and she is getting a kit for smell assessment. So this smell assessment is an early predictor of neurodegenerative disorders. And then I agreed with her, maybe Vinod just didn't know about that. So we are presenting like 50 patients free sample for testing for their smell test as predictor for a neurodegenerative disorder. We will just get their names registered. Afterwards, the one who is interested to go through this test, we could provide it. Thank you, Dr. Zin. So this is the smell test sample. So it is sensitive and specific for the early detection of Parkinsonian features. So we need also to support the unmet needs for care and support. So for caregivers, we need to do holistic approach. It is not just the motor problem. As we said, there is the non-motor symptoms, cognitive symptoms, rehabilitation and the physical activity, social emotional support, and caregiver support. Very important to give the caregivers the opportunity to understand the disease, to understand the progression, and to know how to manage those symptoms. So it is not, if we manage to advise and help the caregivers, we will get better outcome. So public awareness is our mission. So there are lots of Parkinsonian patients in our homes. We do not know that they are Parkinson. Please, if you see your family member, he has slowness of speech, he has slowness of his movement, he has just tremor. Okay, the most easy way to explore this disease is with tremors, but there are non-tremor symptoms for those patients that we need to tackle, and we know what those patients have. So we need also to do or improve the Parkinson's disease research. And luckily we have in SMC and other hospitals in our country, we should improve the research, okay? So we have in SMC and in our public hospitals, we can improve or dedicate some of our team members to do proper registry for our patients and their symptoms, not only for the Parkinson, but also for other neurologic disorders. We need to improve the access to care, okay, and the support services for the Parkinson's disease community. So as in Dubai, we have a wonderful, what we call population of determination. We need to set a patient society for the Parkinson's disorder so that they can express their needs and they can tell us, we can communicate with them through patient advocate to improve their services and their needs. So we need to make a patient society or a league and the Parkinson and the movement disorder chapter through the Bahrain Medical Association. So thank you for your listening. And I want to, from this place now, to call for start of our patient society to improve their services, inshallah. Thank you.
إن مملكتنا البحرين الغالية تسعى اليوم لأن تكون منارة مضيئة في المنطقة تحمل رسالة أمل وعطاء، ويزداد شرفنا باستضافة العالم في طب الأعصاب الدكتور المميز فينود، فليتفضل يخاطب جمعنا الكريم.
I need a moment of your time because there's a difference between a neurologist and a celebrity neurologist. If you haven't met him yet, this is the time for you to meet and greet Dr. Vinod Mehta, representing King's College Hospital, Dubai, London, to describe the Emirates Parkinson's landscape.
Ladies and gentlemen, thank you very much. I'm not sure about celebrity, but I just want to tell you what we are, who we are, and also it helps us to buy the time because there's so many patients still coming in. So basically, I just want to get the screen, please. So I just want to start. King's College Hospital, King's College London, dated back 300 years, where it's home to several legends like Wilson's disease and Todd's. So late legends, and one living legend is Professor Ray here. So he's one of a living legend here of Parkinson's, and we call him as a god. So it's it's a privilege and honor to be a small jewel in that big crown of King's College London. And also, ladies and gentlemen, King's College, there are so many alumni here, Dr. Sheikha and Majid I met today. King's is one of the, King's Neurosciences Center is one of the largest neurosciences center. We are proud to say we are ethnically, rich heritage, economically very diverse. So King's College, you see different ages, races in King's, we can see that one. So that's where the King's is outweighs any other universities or in the world. So ladies and gentlemen, maybe it's help for the, the regulatory authorities to know. So this is the global world data of Middle East. published at the time of 2019, the COVID time. This is the only study which showed WHO that Morocco has the largest number of Parkinson's patients, followed by Saudi and even Iraq. You can see, ladies and gentlemen, there is no mention of United Arab Emirates there or Bahrain, Kingdom of Bahrain. That's the data from WHO. So, and same group, WHO, said average, according to them, 100 patients per, every 100,000 you have 100 patients. So I'm just keep Kingdom of Bahrain next to it, with 9 million. So we anticipated there is a huge number of Parkinson's patients in that part of the world. And this study concluded, again, 2019, that there is a huge unmet need, and people doesn't know what is Parkinson's. People doesn't know. They're going to Dr. A, Dr. B, Dr. C, Dr. D. They say normal, abnormal, normal. So, and they also highlighted that no awareness, we need to provide awareness. And they also concluded Arabs, Middle East, has young onset of Parkinson's. Say, for example, if I see a Caucasian, they get Parkinson's at the age of 75. If you see an Arab, this study showed that there is a genetic related. That means, you know, if you marry same families, automatically the genetics, you see it on. So we did extensive literature search, Professor Ray and I, coming into Dubai. So Emirates, no data, no study. There isn't even a review paper on Parkinson's, to be honest with you. So, and this study from Saudi, I think some of you from Saudi, this group said there is a huge need for training Parkinson's, movement disorders, dementia, training programs in this part of the world. So they said Morocco has one, Tunisia has one, Egypt has one, Lebanon two, and Saudi has two. Kuwait has one, maybe Professor Mishal Center of Excellence, and UAE absolutely zero. So there is nothing called Center of Excellence. And this study showed that because so far, if you see guidelines, UK guidelines, American guidelines, European guidelines, but where is Middle East guidelines? So they say that how the guidelines come if you can hone the training programs. You need to create next generation of movement disorder, dementia specialists. So, ladies and gentlemen, I would say that if you do Google now, Parkinson's, Middle East or Gulf, we can say King's College, Dubai, how it happened. So that's all our journey of from London in 2020. We arrived in Emirates, the journey started. So now King's College Hospital, London, Dubai became a household name in Emirates. I have to say that, household name. So if you say Parkinson's, they say King's. We gained that credibility, and it became a regional tertiary referral center. Not only clinical excellence, we are also the first center. We gained the academic research, care, and we have become a tertiary regional center in Emirates. So King's College Parkinson's Center of Excellence in Dubai, I have to say, if you can see, we have 1,500 patients just parked in King's College Hospital, London, Dubai. You have age, race, religion, everything parked. That's the beauty of Dubai, I have to say. So that diversity, and that's what, this is very important, Farzana. It's very important that, Dr. Mahdi in Bahrain doctors, if you have a trial-related population, all these pharma people will come. Now, because of Donald Trump keeping all these 40%, 80% tariff, they're all running away. So this is the right time for us to develop the database of our Parkinson's patients. So hand in hand, what we did since we started, we are not just focusing on revenue, but we also focusing like outcomes, and we started connecting patient hand in hand. You can see here, we have a Baba son working in Dubai Police. We have a mama's daughter working in DHA. We have another Baba ambulance. So they all work in one. We had this amazing Emirates Parkinson's Association we formed. So I have to say, I'm proud to say that first grant for us by patients. So we have a excellent family called Power Family from Mumbai. He gave us 100,000 dirhams. It's all patients' money. So say that, why can't we collect the data? So that's the first grant. That implies that the faith we gained at King's College Hospital, London, Dubai. Patients giving you, trusting your doctors, single penny, we didn't go it wasted. So, where is Atish? He asked me, who is Parkinson's? What is Parkinson's? So I'm going to tell you. So James Parkinson's first described what is Parkinson's. Name is Parkinson's. But the man here, you can see, Sean Martin, he named bestowed. He said that giving full credibility to James Parkinson, he named the disease James Parkinson's. So that's why Parkinson's became immortal. Even after 300 years, we are chanting Parkinson's disease. That made us all gathered here. So, ladies and gentlemen, first book on Parkinson's is by James Parkinson's 300 years ago. 300 years ago. United Emirates formed 1971. So almost 50 years. But I'm very proud to say that first research paper of Middle East United Arab Emirates is by King's College Hospital, London, thanks to different stakeholders here. Troy, Mohammed Al-Mahdi, Dr. Sheikha sitting there, unconditional support from Dr. Sheikha, Parkinson's Association Emirates. So this research opened up, shed lights, saying that there is a huge unmet need surrounding across the Parkinson's patients in Emirates. You can see an expat, 8-year-old Englishman, Emirati Arab, Parkinson's 40. And also it opened up eyes to regulatory authorities and all the stuff. It's underrated, undertreated, underdiagnosed. Diagnosed, late diagnosis, sent to London. Late diagnosis sent to Germany. Late diagnosis sent to Turkey. So, and also huge delay in treatment. So, and this also sheds a light that everyone Caucasian gets upper limb Parkinson's, whereas Emirati gets lower limb tremor. Why is it? So that's what we received. The government finally opened the eyes and they said, oh, wow, we need to look into it. Why is an Emirati Arab is getting a lower limb tremor? So MBRU, we got a grant to look at it. You can see this is a privilege to share the patients of King's Dubai. 3 generations sailing with Parkinson's. So it's been underdiagnosed. So there are 4 generations with PD sailing on. So we started Parkinson's, Emirati Parkinson's Genome Campaign. One of my favorite patients, very close. So we started just for a laugh. So that's why we started Test and Fight for Parkinson's. Then we started the studies in progress. Tomorrow we're going to share. Here the entire concept is Bahraini is an Arab, Saudi is an Arab, Qatari is an Arab, Emirati is an Arab. But all Arabs have the same gene, or you have an Emirati specific gene or a Bahraini specific gene. At the end of the day, sir, the treatment is gene therapy. We're looking into it. So it's very important to find out what's causing it. And also thanks to Professor Ray, and we received a Government Canada startup grant, digitalizing Parkinson's patients. I will say, doctor, you're the only doctor looking at my mother and treating my mother. Why is the other doctors looking at the computer and treating insurance? So that, see, that Parkinson's, they're sailing. It's not 3 minutes, 5 minutes, what they tell us implies. So there's a huge happening, that's the carer knows. So we have started digitalizing this assessments so that patient comes in, digitally assessments, then 10 minutes by a nurse can do, we get a scores, at least that will help remote patients to do the monitoring as well. So from Middle East, King's College Hospital, London, Dubai, to Southeast India. So you can see the second line, the joints of Parkinson's Research Alliance India. Everyone is a join in Parkinson's disease. King's College is, lucky to be collaboration with Pro India Group. So from there, we started training programs that never had in Middle East. 2-day training programs. I need to share with you. First, I seen Dr. Al-Mahdi and Dr. Farzana join. Dr. Farzana became a celebrity and she forgot us, but Dr. Al-Mahdi is sailing with us. Thank you, Mohammed. Thank you. I'm just joking first. So after that, I'm seeing you here. So we all remember Dr. Farzana. But thank you for your support. So from Middle East, King's College Hospital, London, Dubai. We are going to Forest, thanks to Kimberly, and we secured 1.5 million dirhams grant from an Indonesian Parkinson's patient who came to Dubai. He's saying that, boy, he's a multi-trillion whatever. See, sir, Parkinson's doesn't matter, rich to rags, poor. So anyway, God gave us one blood, one life. So he said, let's do, small support. He gave us a big grant, and what we did, we started visiting training fellowships. So we are not using, its grant to check Emirati genome, but we are helping the Indonesians coming to Dubai. We started how to treat a patient as a patient before so that they can go back with a wealth of knowledge. We started small training programs and also telemedicine to follow up all those patients. So after that bit of Indonesia, amazing country, and I wish Bahrain, I know we are first time coming in, I'm sure it's a bit of Indonesia, multi-diverse cuisine, you can see, that's a pride. So that's the way, so Parkinson's, we make everyone there. So King's Dubai, again, first in Middle East. Saudi, no. Qatar, no. And first Parkinson's, we introduced Parkinson's Watch to the first in Middle East. Parkinson's Watch is artificial intelligence worn for 7 days. So it monitors all your sleep data, tremor data. So we're going to launch, I think the pharma company is running here, the manufacturer to Bahrain. So to invest in Bahrain to launch this watch, and if permits, we can launch with Bahrain Hospital or whoever comes up with. Then we started first MDT. Ladies and gentlemen, this is very important. What's happening? Patient going to one doctor, ice, 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 and becoming water. So they're all coming to us when they're all wheelchair bound. So to stop that, what we developed is one-stop clinic, where you see all the legends sitting there, Professor Ray. So we sit, we discuss the case. This is your one-stop answer. Don't waste your money. Don't come to London. Thank you very much. Yeah. So it's helping the carers that to stay back. Yes, what I'm getting is the best treatment. Don't come back to London. That's come from me. Yeah. So you don't need it. You have stalwarts. Dr. Farzana and the entire team is here. So next one is, so awareness is very important. That's what King's Dubai excel. I'm proud to say, as I said, we connected every baba, every mama's son, daughter, which you're going to see at the end of this session. There are 100 patients, 150 are waiting to greet the Bahrain counterparts. Word of mouth is a powerful tool. No matter how many Abdirahmans, how many Ahmad Munir's marketing directors here, but patients' empowerment, word of mouth, is all matters. They talk, they teach, reach, and preach. That's the way to empower the patients. So we started, see, I can see, ladies and gentlemen, a silent carer who works for Gulf News wrote a beautiful article. We don't even know her. She just came as a part of carer, and she says that, how King's Parkinson's Dubai is, it's connecting. It's a hard work, but it's helping patients. So we work closely with POD Council of Dubai Police. That's people of determination. So they are the ones who actually can help to set up all the free clinics. And I just want to show that what King's Dubai does so Parkinson's fashion show. Just to empower the patients. And last year, we did a Sing for Parkinson's. So just one time. Just to entertain, showing it's not their disability, it's their abilities. So we started doing this in King's Dubai. So I have to share with you, she's a great supporter of Parkinson's, a boss of state of Kerala. She's the health minister of Kerala. She told us that I, as a carer, has to come all the way from Kerala to Dubai. So she came all the way to say that you saved the King's Dubai, we're showing a light. And next, His Excellency gave us Sharjah Cricket Stadium, free of cost, to run. So I think I want to expect all the Bahrain people to join us as well. Don't worry, rest is assured. So I want to share with you academic excellence. First book on Parkinson's, 300 years ago. Second paper by us, third paper by us, fourth paper by us, fifth by us, sixth by us, seventh by us, in no American Cleveland, nothing. So we excelled, also in center of excellence, and we are proving and providing what the amount of wealth of patients doing it. And ladies and gentlemen, what we're doing is every patient comes to us and said, Dr. Mehta, Professor Chaudhuri, I want to fast. My Baba wants to fast. There is no guideline for Parkinson's patients who wants to fast. You have a guideline, UK guidelines, American guidelines, European guidelines for Parkinson's disease, but they're not bothered about Ramadan. So which is our main part of it. So I would like to explain, share with you, this guidelines is getting ready thanks to Mohammed, Mishal, and Bahrain patients that pray, especially the Ramadan regime. I think even after we die, people look for Ramadan Parkinson's, all our names will come. So that's thanks to Bahrain being a part of this one. So I'm going to share with you once it gets published. And also, I'm proud to say that this MRI guided, it's becoming like a mafia, say that buy one, get one free Christmas offer, buy one, get one free Ramadan offer. So the government of DHA asked me to write a guidelines to King's College. So Professor Ray and I, we wrote a guidelines which patient will benefit from this too. So now DHA, the Dubai Health Authority, is regulating. They have a tick boxes, sir. Yes, yes, yes. Then yes, you are. No, no, no. Don't waste the government money, insurance money. So that's what I'm saying is that implies that the credibility we gained among the patients, among the regulatory authorities. So not only academic excellence, King's also clinical excellence. I want to take you 5 minutes. You see young Parkinson's patient, and you see after treatment. So what I'm saying is Parkinson's not a world disease. It affects 30, 40, and you see if you have a sister like this, any doctors you think from your heart, if you have a sister like this, what would you do as a brother? Taking her everywhere, 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 everywhere. And response. So she knows what we need. She's becoming independent. So she lost it. She lost it. So that's Parkinson's 35. And you see Australian legend, Adel is here representing as well. He's a great ambassador for King's, and he's he's to help ATP tennis and all the stuff. He's a great ambassador, our favorite patient. He became like that. He can't come to London. He can't walk. He said we meet in Dubai, so he can't stand. So now, after the treatment, so he went back and playing golf. So the confidence is coming back, and he's became independent, driving himself, and back to London. He's a great cricket player, coming back. So that means Parkinson's is treatable and beatable, but if you need to diagnose it early. And this is one of the patients, again, went to several countries and been diagnosed knee replacement, buy one, get one free again. Knee replacement, it's not knee, sir, it's a dopamine. It's a petrol in the brain. So he can't get up. And after just treating overnight, that's a response. Then he's going back independent. He apparently has 400 acres of camel farm. So he wants to walk, but he can't walk. And we followed up, and now he's enjoying the family. So what I want to imply is Parkinson's not an age disease. It can affect 30, 40, any age, any race, superstars, sports stars, rich to rags. So we written a first book, Parkinson's Unfolds in Sands of Emirates. Thank you to Peabody Council, and His Highness Al Maktoum came that day. That honor is for the royal family, not for us. So he came, that's why we got that one. So, but I'm eternally grateful to Peabody Council. And I want to show you one thing. Why is it I'm standing in front of you and saying that First paper, second paper, third paper. This is all visionary leadership. So we are grateful that we have Kimberly here and Mohammed supporting us, Kimberly. That's all matters. Yeah. So if your management, if your leadership doesn't see the green light in the tunnel, they say this doctor is waste of time. Yeah, there is no point in. So visionary leadership, thank you, Kimberly. We are grateful to have you as the CEO and the team. So that's the team. And I need to thank Rahaf and Kama for your beautiful videos. You know, the hard work Therese, Clara, Hasna, Professor Ray, and I do. That coming in 4 minutes video. So I'm really impressed. And of course, Ahmed, I'm looking at you as well. Yeah. So that's the hard work of the team. So a consultant, sir, we come, we go, wear a nice suits, and we treat. But that 4 minutes. Thank you very much for your lovely team. So I would say thank you very much for your attention. I just want to show you that why we are here, and I'm sure if you're given us an opportunity, we're going to serve our Bahrain patients like what we do with the Emirates patients. Thank you very much for your attention.
Thank you so much, Dr. Vinod. Next, I would like to invite one of our beloved patients from Dubai. Now, she fought the disease. She fought the disease with a lot of dedication. Sorry about that. So this patient, Miss Mahdi, we brought her from Dubai to show you how a little bit of dopamine and a lot of dedication can take her all around the world. Miss Mahdi will be sharing her journey with you. A big round of applause, ladies.
Good evening, everyone. I'm Nadine. Thank you, Dr. Hasna, and my distinguished guests, dear friends, and my fellow friends and family. I stand here before you to welcome you to the very first International Bahrain Movement Disorder Symposium and the first initiative, Bahrain Parkinson'S Connecting Communities program. I wrote something here. I'm gonna put it down. Hearing Dr. Vinod speaking about the initiative, I'm gonna speak about my personal experience with Dr. Vinod and the team at King's Hospital. Do whatever you can to keep this community here in Bahrain, because this is what kept me going so far. I thought it's been 8 years to know this time today, Dr. Vinod, it's been 10 years since we're together. And when I saw the watch, I must tell them about my watch experience. So Dr. Vinod gave me the watch for a week. After a week, he comes, he leaves his desk and he sits next to me and he says, I want to know whether in here you have a brain or an alien. My chart was jumping. Yet, look at me, I'm good. What he said was, if it works for you, then it works. So what I love about Dr. Vinod and his team, they become my anchor. And I don't know what this is for, my speech. What I want to tell you is something that if you believe in something, and if you believe in it in here and in this is how it works. And this is how it's been working for me for the past 15 years, I guess. I went to the States and I started my journey in the States, thinking this is the best medical system that I had. Little did I know that it was a few meters away where I found my anchors, Dr. Hasna, Dr. Vinod, and the team, and everyone at King's Hospital has been mega helpful, and they've become my family. This goes to trash. Thank you all for coming. And I'm here personally if you need any questions or any details about my journey. I'll be here to support this system as an ambassador from the UAE for the Parkinson's patients. I love you all and thank you for coming.
مرحبا بكم again. أنا حكمة عابدين. أنا هني علشان أبوي جعفر عابدين وهو أنا ما أقدر أتكلم فخلي أخوي عبد الله بيتكلم نيابة عني. أوكي.
I will ask you please now to pay attention to the screen and watch the King's video that's been prepared with the hospital.
أخوي مشى وأختي سوسن بتتكلم نيابة.
She always surprises us. I'm sorry, it wasn't prepared. We weren't prepared. I probably don't have much to say except that when my dad was diagnosed, it was very difficult for us to absorb and digest this information, and we weren't prepared even to know much about it. My dad is in the medicine field. He knows a lot about this. Even my sister Hikmah, but for us, I don't like to know more about my biological things because it makes me feel uncomfortable. So we didn't know much about it, but when he was diagnosed, we had to go through this educational kind of awareness process, and he has always been the care provider for all of us, medically and emotionally. For me personally, I had little to offer because for me it was very shocking information to know. But then by time we had to all gain as much as possible strength and join him this journey. I remember the first time when we had to sit together and do all these researches to find out where is basically the best health care provider or hospital that can treat this disease, and whether or not it's curable or can be treated. So then we found out about King's College Hospital, we first time meeting Dr. Vinod, explaining to us what is it and what's the process and what would be the potential progress for us to be ready for it. I think until now, I'm not ready to know what's the progress, although it was explained for me. I'm still not digesting and absorbing, and at every stage, I personally take my time to basically adapt. But the rest of my siblings, I must say, are braver than me and stronger. And we all learned this strength from my dad, accepting and fighting until today. My father sits, and he's an artist. He likes to play music, he likes to draw, he likes arts. Besides his very tough job, he still fights his disease, and he still wants to do a bit of these. He still likes to read. Sometimes it's difficult for him to read. We sit next to him, we try to read with him. My sister-in-law, my sisters, everybody around the family tries to do a bit, whatever they're interested in, that he's interested in. I think that journey has been the entire family journey, without everybody coming together, learning, and trying to understand what is the best process to help him go through this journey. And it's not only his journey only, it's also everybody's journey within the family. I must say thank you for everyone, and I think it's pleasure to have, this is the very first event bringing together us as family, and the healthcare providers, hospitals, and it's really great to see King's College with Bahrain Specialist Hospital, and also very kind of key doctors in this sector are all here today, gathered, sharing experiences and trying to do something about this disease, and helping us as well with our journey and fighting this. Thank you very much, and pleasure seeing you here.
Thank you. Sausan, I wouldn't call it a disease, I would call it a challenge. Allow me at the start of every part to share a short experience of my personal experience at King's and with Parkinson's. Ramadan last year, I go to Dr. Vinod and I say, I'm fasting. He's like, no, never. Can I tell a secret now? I did. He doesn't know. I did. I switched my medication to the nighttime, and it worked perfectly well. I know you'll hate me for saying that, but I did. Please, Dr. Vinod, you wanted to welcome someone on stage? No? So we'll go for the video.
Welcome and greetings from King's College Hospital, London in Dubai. My name's Kimberly Pearce. I'm the CEO here in Dubai. However, my message to you today is one of a more personal nature. So Parkinson's is something that's very dear to my heart. My stepfather was diagnosed with Parkinson's when he was in his early 50s. However, we were not able to access the type of treatments that have been made available by Professor Ray, Professor Vinod and Professor Gar.
life without a dark cloud over my head. I have to say that everyone used to come to Jeddah for Parkinson's or Saudi. Now, since last few years, I personally witnessed how Dubai has become the regional hub and the international hub, really, for Parkinson's patients. This is true. I'm the first one to tell you this. This is because of all the hard work. Parkinson's care is getting transformed at King's Dubai. It is not just clinical outcomes, innovative research, bringing new therapies, new treatments, technology. I was one of the first patients to test and benefit from the Parkinson's Watch. London, the care that I've seen here and the professionalism and the dedication that I've witnessed at Dubai's King's is unparalleled. Nadine said Dr. Vinod is a magician. That is not giving him enough credit. With Dr. Ray and Dr. Guy, I've seen miracles take place. I don't want to use fancy words, but what is happening at the Parkinson's Excellence Center in Dubai.
أتمنى للدكتور ميتا وفريق عمله كينز كوليدج دبي كل التوفيق. بداية أعتذر لسموه ولجميع زملائي المرضى حول العالم بسبب الانتخابات.
I'm genuinely touched and deeply moved to see all of you here today, this evening, coming together today to demonstrate unity for Parkinson's patients. It's incredibly inspiring to doctor to the stage with the introduction that, see, he's my magician. Dr. Mehta is really a magician, and he, with his magical touch, not only transforms the life of Parkinson's patients, but also transforms the lives of the caregivers and the families. Thank you very much.
Connecting Parkinson's communities. Household name. Being part of the Eminent Parkinson's Awareness Programme is truly a privilege. I understand that Parkinson's UAE is expanding its horizons 3 years ago.
Only a caring doctor, but also a passionate cricketer.
I have one humble request for King's CEO, Ms. Kimberly Pierce. Please do not keep Dr. Vinod Mehta all to yourselves. We need him back in the UK, please. Don't lock him in Dubai.
Back here, where I'm meant to be. That place was here, at King's Hospital, and the care of Dr. Vinod, where I have not seen where he is. Where are you, Dr. Vinod?
Airlines connect global countries, but Emirates Parkinson's connects global hearts. That's what I always say. It's a heart.
Life is still contributing to society in such a positive way. So I just want to say thank you for everyone for coming.
If we are to learn anything from this video, is that Parkinson's does not discriminate. I was 33 when I was diagnosed. It considers no age. So this is why today here in Bahrain is so meaningful. Because what I found at King's, care, trust, and belonging, is now being reflected here in the form of Parkinson's community. This is not just a launch, it's a gathering. It's a family getting together. It's us telling the world that we can still communicate and speak about what's bothering us, what's painful, and they would listen. And they would tell us what to do, right, Dr. Hasna? When I call Dr. Hasna at night, and I say, Dr. Hasna, I'm in pain. And then 5 minutes later, she'd see me jumping and listening to music, and so is my niece, my caregiver. Because, again, it's the support that I get and the confidence that I get that it's a matter of time. This too shall pass. So I never felt abandoned, and I never felt alone, and even my carer never felt that she's alone with me. We support each other, and this is not only in Dubai. This is, as you saw, all over the world. So please, let's learn from this video, and let's make our family bigger. The bigger we become, the more we can do things for our patients, including me. Let me please welcome to the stage, just a moment, Dr. Hasna. She even helps me here. No, I'm done. I'll invite the Managing Director, Dr. Qasim, from the Bahrain Specialty Hospital to join us on the stage.
سعادة الدكتور أحمد محمد الأنصاري رئيس التنفيذي للهيئة الوطنية لتنظيم المهن والخدمات الصحية، سعادة السيد حامد زياني رئيس مجلس إدارة مستشفى البحرين التخصصي، سعادة الدكتورة لولو شويتر وكيل وزارة الصحة البحرين، سعادة الدكتورة رجاء اليوسف نائب رئيس التنفيذي مستشفيات الحكومية البحرين، دكتور فينود ميتا King's College UK in Dubai، Ms. Kimberly Pierce, Chief Executive Officer, King's College Hospital, London and in Dubai. Dear King's College team, dear distinguished speakers, dear patients, caregivers, colleagues, and guests. It gives me great pleasure to welcome you all on behalf of Bahrain Specialist Hospital this evening on the occasion of inaugurating the King's College Parkinson'S Center of Excellence at Bahrain Specialist Hospital, and the opening of the first International Bahrain Movement Disorder Symposium. I am confident that your attendance tonight and tomorrow will confirm the importance of this topic to the Bahraini community, as I am confident that this opening of the King's College Center of Excellence in Bahrain Specialist Hospital will add to the extensive services already provided in our hospital. Dear guests and colleagues, thank you for attending this activity tonight and the scientific session scheduled for tomorrow. We all are committed to contribute each in his or her own field to better serve the community with the latest advances in this field. Thank you again, and I hope you have a very good session tomorrow. Thank you. I'm very happy that one of the future King's College students is with us here tonight, and I'm happy that she is here because this reflects commitment of the Bahraini students to pursue their higher education at King's College in London, and I'm very happy that she is here with us tonight.
It is my honor now to welcome to the stage Dr. and the CEO of King's Hospital, Ms. Kimberly, to give us...
Welcome, everybody. Distinguished guests, ladies and gentlemen, but more importantly, patients and caregivers, because you're the ones that are the special ones here. So it's a privilege for us to come to Bahrain. As Dr. Vinod has said, it's a community, it's connecting our communities. As a result of that, we've also been working very closely with Bahrain Specialist Hospital, and we will be opening a clinic here in Bahrain, partnering with Bahrain Specialist Clinic, so that we're really proud to be able to do that. What's important to us is to bring care closer to home. We appreciate that it's quite difficult for people to come all the way to Dubai, and so we want to be able to give you the care here, as well as give you the care in Dubai, should you wish. So I want you to have a really good evening, network. It's a fellowship, it's a community, as we've said, and you get most strength from each other. It's really important to speak to people like Nadia, who are going through your similar issues, because patients, caregivers know what works well for them, and you can learn from each other. So thank you, have a great evening, and I'm handing over to who?
I'd like to invite now our guest of honor, Mr. Hamid Rashid Al-Zayani, to the stage. He has a surprise to tell us about.
What am I supposed to do? Okay. Well, nothing makes me more proud than seeing another excellence added to Bahrain Specialist Hospital. This is a systematic way we're going about adding specialities. We started with heart, something in eye surgery, and now the most pleasant story for me is that this is done without me. And this shows that the system is working. The initiative is coming from the people that we have hope that they will do it, and they are doing it. There is a lot coming in the pipeline. I'm very grateful for the team, and it's always good to get credit for something that you haven't done it. Thank you very much. Thank you.
So we would invite Sir to remain on stage to present the mementos to the invited guests today. And the screen you can see has changed as part of the launch program.
I'd like to invite to the stage Dr. Ahmed Mohammed Al-Ansari. Dr. Maryam Al-Jalama. Dr. Mohammed Saeed Al-Rakbani. دكتور شيخ المزروعي. والله إحنا حاطينك دكتور، ألف مبروك، تخرجت معنا. Thank you. شو يا حبيبي؟ Please welcome to. أكيد. إيه بعدها.
Thank you so much, Ms. Nadine. Ladies and gentlemen, it's my pleasure to welcome Ms. Kimberly Pierce, Dr. Ahmed Mohammed Al-Ansari, Dr. Lulwa Rashid Shawaiter, on On behalf of Dr. Mariam Al-Jahama, Dr. Raja Al-Yusuf, Mr. Mohammed Said Al-Rakbani, Dr. Shaika Al-Mazrui, Dr. Qasim Ardati, Dr. Naja Rashid Al-Zayani. It's actually, the stage must be feeling the weight of excellence. We will present the mementos now.
No, next.
Apologies for keeping you waiting. The ladies are bringing in their high heels. Good, good. Thank you so much, ladies and gentlemen. Let us say cheers for a picture. Now, I would like to invite the distinguished faculty to receive their mementos. Thank you so much, ladies and gentlemen. However, I would invite Mr. Dr. Qasim Ardati, Dr. Raja Rashid, and Mr. Hamid to remain on stage to present the faculties with their mementos.
Where is the mic? I think the Honorable Chairman, you need to stay back on the stage. We'll take the big memento. And Dr. Nazar needs to stay back on the stage. And Dr. Qasim needs to stay back on the stage. Yeah, they invite you. Yeah. Now, I will ask Chairman and Dr. Nazar and Dr. Qasim to invite the international faculty and all the faculty to one by one to the stage, please. I will ask Professor Ray Chaudhuri, the God of Parkinson'S, to come to the stage and take his memento, please. Thank you very much, Professor Chaudhuri, for coming to the stage. Now I'll ask Professor Parodin, who flown all the way from Sweden to come onto the stage. First time the professor coming to Middle East. So give him a great welcome. Even one night he fell in love with Bahrain last night. So maybe he relocates to Bahrain. Thank you, Professor Odin. Thank you for coming all the way to Bahrain. Now I'll ask Professor Goyal, please, to come all the way, the man and the director and was the AIMS before, and now Medanta, one of the doyen of movement disorder specialists, to get the memento from the chairman and Dr. Naza and Dr. Qasim. Thank you, Dr. Goyal. Now I'll ask Dr. Farzana to come. She knows she needs no introduction, but always. Thank you, Dr. Farzana. Now I'll ask Professor Dameja, the doyen of movement disorders from Delhi, and part of the PROI program, to come on the stage, please. Thank you, Professor Dameja. Now I'll ask the evergreen, the professor from Poland, Professor Carolina, to come on stage, please. She changed 3 flights to come to Bahrain. Thank you, Carolina. Thank you, Carolina. Now I'll ask Professor Rupam, the doyen and the director of PROI, to come to the stage. He taught and trained so many neurologists and Parkinson'S specialists in India, so everyone keeps his name in the brackets. Professor Rupam, it's a honor to have you here, sir. Now I'll ask Dr. Rukmini Murzula to come to the stage, please. You need to write all your names. You need to write here. Tell. Doctor of Movement Disorders and Parkinson's Specialist from India. Thank you, Rukmini. Thank you, Rukmini. Now I'll ask Professor Guy Chung Fei from King's College London, the Director of Bowel Cancer Screening from London. Dr. Naja, he will be your helping you with Parkinson's patients. Gastroenterologist and Director of Bowel Cancer Screening from King's College London. Thank you, Guy. Nice smile. Now I'll ask Dr. Samir Naik, the consultant lung and specially dedicated for Parkinson's at King's Dubai, to come, please. Thank you, Samir. Thank you. Now I'll ask Dr. Hani to come. Hani Humaida. So sorry, sir, your name is in Arabic. I'm reading it correct. Where is Rahaf? Hani, please come, Dr. Hani. Take your memento from. Thank you. Please take a seat. Thank you, Dr. Hani. Thanks for coming all the way, supporting us. I'll ask Dr. Samir is done. So I'll ask Professor Sampath Kumar to come and take his memento. Sampath is a dean and the director of movement disorders from famous NMC Medical College. Tried so many, part of our PROI. Thank you, Sampath. Thank you, Chairman. Thank you, Sampath. I'll ask Dr. Majid. Majid Abdali here, or he went to toilet? He's here. Sorry. I've seen him sneak again. Ask him. Okay, we'll get very easy. Right. Now I'll ask Dr. Adel Al-Jishi. Yeah. Huh? Oh, I see. Yes, because, Madam, I want you to come to the stage and take the memento, please. Please. On behalf of Dr. behalf of, please announce. I don't know. Yeah. Please come. Now I'll ask Dr. Wissam. Dr. Wissam here, please. Yes, please. Yeah, Dr. Wissam is to be a great support of King's College London, Dubai. Thank you, Dr. Wissam. And he's a pioneering in stem cells. And we want your expertise to be in Bahrain as well, Dr. Wissam. I think we have done now. I think we are getting so many messages from patients who are waiting in Dubai. So I want to say Dr. Nazar to say a few words, and we will we'll start our free clinic.
I would like to welcome the patients who are our inspiration. My patients always are my inspiration in my practice. I would also thank all the speakers who took the time and effort to share with us their expertise and educate us in the field of Parkinsonism and the latest developments in the treatment of this disease. I certainly have dealt with a lot of patients who are suffering with the consequences of this disease, and I even get to see them because of eating or swallowing disorders in their latest stages. So I'm very grateful for everyone who contributes their knowledge, their skills, their compassion, and their care in taking care of these patients. And I look forward to being a center of excellence in Bahrain and learn a lot from the King's College group and their patients as well about how to handle these cases and how to give them the best quality of life and the best treatment. I also look forward to new innovations in the field that will lead to a cure or at least a certain permanent therapy without the use of continuous daily drugs. I'm very hopeful, and with very little knowledge in this field, I'm also expecting there will be a revolution in targeted therapy, and I look forward to hearing about it. Thank you all for coming, and hope we see each other helping all these patients. And I hope that our professors who are here with us today will continue to teach us lessons in the management of this disease. Thank you all.
Their discussion. I'm going to tell you. Sorry? Okay. Mr. Huzaifa will be joining us on... Yes, please. Mr. Huzaifa will be joining us on Zoom.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Professors, my dear doctors, my brothers and sisters, patients and carers, from the depth of my heart, I welcome you all. Today, I'm speaking to you virtually from the United Arab Emirates, but wallah, I feel as if I'm sitting amongst all of you there in Bahrain. This gathering is just not a conference. It's just not about Parkinson's. It's about hope. It's about unity. It's about telling each and every patient and every carer in the world, you're not alone. I must confess something. It's very personal. I truly miss having Parkinson's master classes in Dubai this year. We're used to having the master class in Dubai, United Arab Emirates, but this year it's there in Bahrain. If you ask me why, because the master class, it was not just an academic event. It was not just about presentations and slides. It was not just about faces. It was about people. And that's what we've learned from the wise leadership of the United Arab Emirates. That the human being is the basis of everything. This masterclass, it was about sitting across next to world-renowned Parkinson'S specialists, and for the first time, feeling seen, feeling heard, feeling understood. Trust me, this is a feeling that only a person with Parkinson's knows what it is. As a patient myself, these sessions, I don't call them just sessions. These were lifelines. These sessions, they gave me strength. They reminded me, although my body trembles, my heart and my faith remain unshaken. They reminded me that Parkinson's might slow me down, but it cannot silence me. And inshallah, the way I look at things moving, the first time when I saw the list of the faculty, there was one name that actually struck me. It was Professor Perodin, who has always joined us virtually, but he never joined us in person. But trust me, my brothers and sisters in Bahrain, Professor Perodin has joined you himself. That means a lot to me. And I'm looking forward to seeing you, Professor Perodin, here in Dubai, United Arab Emirates. And I tell you, Dubai and we await you. We're looking forward to having you. And there is one thing that I would like to tell you, Professor Perodin, as I would like to remind each and every one of you there in Bahrain, my brothers and sisters. His Highness Sheikh Mohammed bin Rashid Al Maktoum, what he has shown us, the Emirate of Dubai is more than a city. It's a dream built on determination, a vision turned into reality. But before I go further, I must stop here and say thanks where I have to, because as the Prophet Muhammad alayhi salatu salam, he taught us, "Man la yashkar al-nas, la yashkar Allah." There is one person that I would really like to thank you after Allah, and I say this from the bottom of my heart. If I'm able to move, if I'm able to speak, if I'm able to be here before all of you together and speak to you, it's because of only one person. It's Dr. Vinod Mehta. Are you there, doctor? Can I see you? My brothers and sisters, I would like to share something with you. It's so good to see you. There is one thing, that I say about Dr. Vinod. If there is one person in this world who knows my RBCs and WBCs, is Dr. Vinod. He knows each and everything about my body. And he's the only one person that I trust. I've seen a lot of doctors, but he's the only one I trust because he's the one after Allah who moved me from being someone who was dependent on everyone to be independent. Allah made him the reason of transforming not only my life, but many other lives. I'm sure most of you here who have joined us, be it online or be it whoever is in person, and especially the CEO of King's, Kimberly Pierce. I can see my sister, Dr. Sheikh Al-Mazrou'i on screen. Well, it's so good to see you, my sister. I'm going to talk about you. I have something very special for you that I'm going to speak my heart out. Kimberly, I'm sure you have seen how many lives got transformed at King's College London in Dubai because of Dr. Vinod Mehta. And I would just like to say that it's because of Dr. Vinod, I'm not just surviving, I'm speaking, and that means a lot. Trust me. I'm moving. I'm able to, because of Allah and because of His support, I'm able to connect communities. I used to say across the Emirates, but now it's because of all of you in Bahrain. I say that we're able to connect communities not only across the Emirates, but it's the first time I'm speaking this out, that we're able to connect communities across nations. And that means a lot to me. Dr. Vinod, my brother, may Allah reward you. May Allah bless your hands. They heal more than patients. They heal entire families. No one knows this as much as we as patients do. No one knows this as much as our families do. My family is always grateful to Allah and to you, Dr. Vinod.
Next time I need you here on stage with me. Next time
I will be, inshallah.
Yes, yes.
I will be. Nadine, by the way, trust me, when Dr. Vinod spoke to me, he was like, I want you to be with me in Bahrain. I told him, I'm not the right person. I'm not as good. I don't speak as good as you, Nadine. You're better than me when it comes to speaking.
That's why we are here together.
You're more expressive than me. So I chose you
I work in media,
to be the.
That's why.
I can see that, and I said that the one person who's more expressive, better than me, and who I call and I send as an ambassador from Parkinson's UAE is you, Nadine.
Thank you.
Thank you so much for whatever you do. Thank you so much for your great words. Trust me, your words not only touched my heart, but they touched my soul. And I'm sure it's the same with each and everyone who's there and each and everyone who has joined us virtually.
Thank you. Thank you so much.
Thank you, Nadine. I also would like to extend my deepest gratitude to our brothers and sisters from PRI, especially Professor Rupam and the entire PRI team. My brothers and sisters, your guidance, your collaboration has lifted Parkinson's UAE from just being an idea to a movement, and to the Bahrain Specialist Hospital, and especially Dr. Qasim, Mr. Majid, Dr. Adel, Dr. Mohammed, thank you from the bottom of my heart. Today, you're not just hosting an event, you're building bridges. That means a lot. You're showing us all what true partnership looks like. And to someone who's very dear to my heart, Professor Chaudhuri, who I call him, are you there, Professor Ray? Can I see you? Professor Ray? Good to see you waving your hand. I always refer you as my guiding star. You've been an inspiration, not only to me, but to countless patients around the world. Thank you for your guidance. Thank you for your support. Thank you for dedicating your life to this cause. This really means a lot to all of us. And to Dr. Mishal, Dr. Majid, Dr. Guy, Dr. Farzana, and each and every one of you, I'm sure I might have missed many of your names. I'm really sorry for that. I have Parkinson's. My memory isn't as good as all of you.
La, mashallah,
Sorry
it
about
is.
that.
La, mashallah, it is. You remembered everyone.
No, I'm not as good as you. I'm not in media.
لا بس ما شاء الله يعني ما شاء الله عليك. خلص next time عندك كتير تقوله تكون معنا إن شاء الله.
I'll try my best, but
Thank
you're the
you.
best, Nadine.
Thank you so
much.
much.
All of you across the Gulf and beyond, thank you for making this truly international. My brother, Dr. Mohammed Al-Ragbani, I can see you sitting there. Thank you so much for being there, for representing Dubai, for representing all of us. You're an inspiration, you're a support that not everyone understands what you do, but I know what you do, and that really means a lot to all of us.
Thank you so much. Thank you for your time. And I would like Dr. Hasna to introduce the next.
The last speaker for the day, the boss from Dubai, the lady behind stem cell research, our beloved, Her Excellency Dr. Shaika Al-Majroui, to say a few words and launch the free clinic.
Before my sister, Dr. Sheikha, I would like to say a few words about you.
Thank you very much.
You're my sister. You're a daughter of the United Arab Emirates, and you carry in you science and compassion, leadership and humility in your work leading the stem cells in the United Arab Emirates. You're giving our nation a future of hope. You're showing the world that the UAE is not about building towers of glass and steel, but also towers of healing, knowledge, and dignity. Your journey is an inspiration to all of us.
Thank you.
You may proceed with your talk.
Thank you very much.
Thank you, my sister.
Yeah, thank you, Hudayfa. Thank you very much. Actually, I still remember when I received the call from Hudayfa. I was so touched when he called me and he told me that he is diagnosed with Parkinson in a very early life stages. And I've known Hudayfa for long. He's full of energy, full of life, and I knew that it will not stop there with him. With his determination, he decided to form the UAE Parkinson Friends. And on behalf of the UAE Parkinson Friends, it gives me the whole pleasure to be standing before you and to present the launching of the free clinic of the Parkinson here in Bahrain. So with this, we are welcoming any questions from the patients to the physicians, and we are looking forward to connect patients and friends.
Are the doctors?
And if we can solve the mystery, if 50% of this problem, I will say 70% of the problem will be solved, and he will have an you can say.
What has improved in any kind of medication, any person. This what they have here.
Don't worry, enough support of people. Don't cry.
I'm so happy.
I'm sitting here and I'm working for it. I had a great time. And thank you very much for bringing such wonderful faculty. Because now my knowledge is enhanced. I was scribbling.
So our charity is based on patient voice, patient choice, enabled by the clinician. Just 3 points.
Patient's choice, patient's voice.
Nothing.
I would like to invite Dr. Vinod Mehta to moderate the free clinic.
Ladies and gentlemen, I don't want to take much of your time. So sorry if the program is because of patients coming in. It's a bit of a delay. So now what happens is a huge promise. There are 100 patients waiting, as you see. They have lots of questions. And we have some patients or carers already asking me in the entrance, getting my tie off. So what happens now? It's a pure, those patients who don't have an access to all the super doctors here. Sir, they have lots of questions. So we will start the clinic. So all the world experts will come onto the stage. So the chief invitees and guest of honor, if you are bored, sir, thank you very much for staying here. So with your permission, we can start our free clinic. It will go on patients' questions. So we will start the clinic in 1 minute, madam. 1 minute, please. 1 minute. So we will ask the consultants to come here. We'll make some seating arrangements.
stand, no? Because they cannot see. Or just put here. Ate Teres. Mike. Mike. Okay. Maybe we can have another one.
Which one is low?
That one.
That one.
This one.
Okay, this one is okay.
Then another one.
Hello.
Another one. Because for the doctors.
Doctor, do you want to moderate? Huh? See, give me the mic. Oh, you need a mic. I think you should go to the patients.
Yes,
the mic.
doctor.
Come here, Doctor. That's fine. Just relax. Huh? Come here, Doctor. I'm so stressed.
Ate, pupunta na ako sa kabila. I will go there.
So, ladies and gentlemen, we're going to start the Parkinson's connecting program. So we have patients waiting all the way from Dubai, Al-Ain, and also from Fujairah, Mohammed. Few patients are from Fujairah, and Ras Al Khaimah. And also we have our friends here, Bahrain friends. So I'm going to see what happens. We will give top priority because they are waiting since last. I'll give one question, one question, one question, one question. Okay.
You will ask something now.
I'll introduce you, Professor Ray, the god of Parkinson's here. And
He needs no introduction.
so, we'll start with the first question. There is first question. Yeah, Clara, you're there. So, once a chairman. No, Doctor, they're all. I think we should keep it down. Keep it down, please. Take your seats. Keep it down. So if any other doctors wants to join, they can join here. Ask Clara, Asna, anyone Bahrain doctors wants to join. So, sir. Dr. Farzana, you don't want to help us? So, we're going to start. Chairman, shall we start the clinic? Patients are waiting. Mohammed, we'll start. No, yeah, my patients are waiting. Right, first question. See, madam, you need to tell your name and ask your question.
Yeah, it's on.
And you're from Bahrain.
Okay.
Yeah, your name and question, then Professor Ray will tell who is the specialist. One is dementia, one is petrol problem and everything, gastroenterology. So we take one question from you, one question from the Dubai patients. Yes.
Hi, everyone. My name is Noura Dawood, and I'm talking about my father, Dawood Hussein Al-Mana, here with me.
Hello, sir.
Yeah. He's a 76-year-old male, known to have Parkinson's since 2022, around 3 years back. And since then, he started to have Sinemet medication, levodopa, carbidopa, 3 times a day, but it was gradual until 3 tablets a day. So my question is if any alternative to this medication, because lately he started to have the controlled symptoms, mainly was tremor, upper and lower limbs tremor, which is controlled, alhamdulillah, so far. But the thing is, newly happened is the what they called it orthostatic hypotension, postural hypotension. Most of doctors said either because of Parkinson itself, and others said because of medication side effect. So my question, and he was wondering if any alternative to this medication, which has less side effect, better life to goes on without the hypertension. Especially, he started to have the 4th tablet a month back and goes not okay, so he has to stop it because of the hypertension. This is number one. My second question regarding the swallowing. Recently also, he started to have very difficult in swallowing. He feel like something in his throat. Also, we go to ENT specialist, we go to GI, and they advise to have PPI medication, the anti-reflux medication, but still, I don't know the relation between the swallowing and the disease itself. If you can help me, please.
Excellent.
Thank you so much. Thank you.
First of all, are you a doctor?
Yes.
Yeah, see, how did I spot it? Yeah, because the way you gave me the history and the way you explained, are you a general doctor?
Family physician.
I can see that. See, yeah, no, see, we are not that bad, eh? Yeah. Thank you very much for, you know, I can see that the way you presented, that you're a doctor, and we need family doctors need to have more awareness than this thing. First, what I do is I will brief the case to the specialists here, then I will ask, I'll choose them. So daddy's 72.
76.
So, yeah, and Parkinson's for 3 years. And they started Cinemet 100 by 25 or 200 by 50? 100 by 25 or 200 by 50? 200 by 50. And he's taking thrice a day. So before I tell the experts, one more question. Has he had any problems with high blood pressure?
It's the opposite. It's always low
Right.
blood pressure, always.
So always.
Yeah.
So he
as
has-
low as 90s
So
over
you
60s.
always have a low, like hypotension, low for many years.
Yes, he's
And
suffering now,
Does he
lately
have,
more.
Yeah, any other medical problems like diabetes?
Only cholesterol, high
Only
cholesterol, and he's
cholesterol.
on Crestor.
So this low blood pressure has been, the cardiologist has seen him. Why is he getting low blood pressure? Right. And how low was low? How low is it going?
Since very long time, but
Yeah.
it was not bothering that much.
Right.
But lately, like let's say 1 to 3 months, it started to have, it's affecting his daily life.
Right. So what was the latest?
Uh,
Because
the-
you're
the
a doctor,
readings-
I'm
the
asking
readings,
you,
yeah,
that's why I'm
yeah,
asking
I
you
can
one
understand.
question.
Lately, it was reaching 90s over 60s.
Right.
80s over 50s.
Right.
Yeah, this is
So
the lowest.
The lowest goes 80 by 50.
Yes, yes.
And especially in the mornings.
Yes.
Right. Fantastic. Thank you very much, doctor. I will pass it on the question. So we have a very specialist here. So Professor Dementia, he's a movement disorder specialist. He's a movement. Give me the mic, please. He's a movement disorder specialist. So he's a movement disorder special interest in autonomia. Autonomia means where the heart meets the brain. So I will pass it on the mic to Prof.
Thank you very much for the question. So if we understand, your first question is whether there is an alternative to the Cinemet. So with your dad's condition with 3 years of Parkinson, Cinemet is still the #1 and the best treatment available. That is, and we start with this, and I'm sure that it would have been started go low and go slow, and now you have 3 tablets, 250. And it's working very well, I believe. The question is, he's having a postural hypotension or orthostatic hypotension, which is well known, but there's nothing, you have to have an alternative to this, to Cinemet. You can continue with Cinemet, but there are measures. The first thing we always do is to have a 24-hour ambulatory blood pressure monitoring. So there are many autonomic functions which dysfunction which happen in Parkinson's disease, and especially when patient has a precedence or a past history of existing hypotension. But the more important is also hypertension. Some people also have supine hypertension. So if your 24-hour ambulatory BP monitoring shows that there is a non-dipper or a reverse dipping and there is a pressure going down while standing or sitting, that is something to document it first, and then there is a treatment for that. There is a treatment for non-pharmacological like salt intake or restriction of fluids and the leg binders, And then there is a treatment for the drugs also with midodrine and fluorocortisones and all these things. So I think he needs to have to this monitoring, number one, and then treatment for the postural hypertension. I will not recommend stopping Sinemet at all. It is still one of the best treatment for his disease.
Thank you, Prof. Dementia. I would say that what he's saying is, if the Sinemet is started with 100 by 25, then increasing it to 200, then that's the good clinical practice. Normally, we don't hit 250, and that means, it's a pulsed, so that might cause it. So what I would suggest, 3 years, it's not a long-standing Parkinson's. Maybe the 600 milligrams of levodopa is compromising the blood pressure. So what I would suggest, I would do, if it's my patient, if that is my patient, I will say 200, 100, 100, and monitor the blood pressure. Then 100, 100, 100, monitor the blood pressure. And if still low, then as Prof. Majid said, then we can start considering a small dose of alpha blocker, which is very safe in Parkinson's. What do you think?
Yep, I agree with that. One other clue is that sometimes you might change the Sinemet to Madopar.
Ask them to sit.
I don't know whether it's available here. Sinemet contains levodopa with carbidopa. Madopar is levodopa with bensarazide. Same thing. Carbidopa has a more blood pressure lowering effect than bensarazide. So sometimes just switching and doing as Dr. Vin and Prof. Tamija said, which is increasing the blood intake, the water intake, salt, and putting in ephedrine or fluorocortisone, small dose is useful.
Where we can find it if not available in Bahrain? This is
Don't worry, madam. Kings is coming to you. We got all the treatments. That's why you need Kings. That's why you need Kings. That's why you need Kings. That question. So, number one, I think once you cut down, so first, instead of overnight switch, because daddy has got used to carbidopa, I would do slow 100, 100, 100. I'm sure it gets stabilized. Then touch wood, it will become anything, because it's a long-standing hypertension, experts. So nothing to worry about it. Anything 190 is safe for that. Yeah, because if we add anything else, milracot, then you'll get supine hypertension. So that's the immediate plan. That's the one. Okay? Thank you very much.
Second question.
Swallow, right, okay. So I will summarize. Yeah, I will summarize. So we have an expert in gastroenterology. So I'm going to ask him, is it the doctor, she's a doctor, family physician, Professor Gai Chung Fei. So is it central or is it peripheral, dysphagia? Is it coming from the brainstem or is it just peripheral? That's what he will explain to you with a gastro. You see, you have a gastroenterologist, you are autonomous. So
we are very lucky.
Thank you very much. Thank you for the question. Yes, I mean, it's very common for patients with Parkinson's to have swallowing difficulties. In fact, they have reduced swallowing, hence the drooling. But also, I think it's important, one, to exclude a primary cause for the swallowing. In other words, is there a problem causing the swallowing? And I think what you need is a barium swallow or a water-soluble contrast swallow. One, to make sure there's no obstruction, such as a lesion causing it. And then also to exclude things like aspiration. And if that is clear, then it's more of a sort of neuromuscular functional problem, in which case you get a speech and language therapist to assess the patient and give some further advice. Thank you.
I think this swallowing function in early Parkinson's is now been recognized quite clearly now, in early Parkinson's. So get a speech and language therapist evaluation, whether it is video fluoroscopy or just the swallowing function, dysfunction, and dietary modification would be helpful probably.
I think diet is very important. Get a dietary advice about the consistency of the food so that there's no choking or coughing while they're swallowing, because that might mean aspiration. And it's very, very important that you get a speech and language therapist to do an assessment, so make sure there's no aspiration, because that's a risk factor for pneumonia. So I think it's really very important to do that. One more comment?
So to summarize this swallowing problem in Parkinson, we should investigate properly because it can be a cause, as Dr. Chaudhuri said, it could be a cause of pneumonia or recurrent chest infection. Okay, so whenever you feel it, you must do as Professor Guy said, that we need to do early swallowing assessment. One of the things that does not happen consistently is that we do not us as neurologists, but most of practitioners do not go for the water-soluble assessment of swallowing, and this is a very accurate one, and it shows us if the contrast is going to the chest or going to the gut, and also it shows us if there is delay in the deglutition. At the same time, in this test, we can assess if, because it's water-soluble and liquid, this is first part of the test. If we see that there is some leakage inside the chest, so we can add thickener to the contrast, and we take like bolus, we see how it swallows. So it's better to identify quite well what is the problem and to treat it even with simple things like thickener, and it would help much to prevent chest infection. No, the neurologist can ask for that one. It is a test like chest X-ray, and when we do it, we see quite well is there a risk of aspiration or not. Okay?
Okay, thank you. So basically, doctor, you need to check there is anything brainstem insult on the imaging, MR brain, and a video fluoroscopy to see the stages of swallow. You get an answer. Sorry, Dr. If it is video fluoroscopy, that's different treatment. You need Professor Guy Chengfei. If it is a brain, you need one of these experts here. Right. Now, we're going to take second question.
I have a question, and perhaps it's also...
Shall we take one from Dubai and alternate? Okay, you are the VIP. Go on.
Thank you very much. So it's also complementing, her question, which is basically, the ability to swallow and the troubles associated with the medication that is being prescribed for Parkinson patients. And also what matters pretty much, and this is what we have been told throughout the journey, the timing of the medication, how timely it is, and which is basically very difficult to maintain, because also Parkinson patients have different sleeping patterns, and it's not within your control. So again, while medications prescribed had really helped the progress of our Parkinson patient, it also came with associated troubles or issues or challenges that then we had to look for alternative solutions, that basically the question that you have asked. I mean, thanks to Dr. Mohammed, Al-Mahdi, who is my also father's doctor, alongside with, Dr. Vinod, in our continuous kind of search journey for alternative and improvement in the medication. So Dr. Mohammed was able to source an alternative solution, but again, this is an injectable medication that has to carry all the times, and it works with him, throughout. We don't have to do any changes to it. It caters for these timing issues and challenges. It also addresses a lot of other challenges like swallowing medications. It has been really, really working great for him, and has been really such a relief for us and for him. The only challenge, which is the main and the biggest challenge we face here, is that we have to travel every month to Dubai to get this medication, okay? And it's costly. It's very costly. So that's a very, it's a big challenge, which we basically are trying, and we are hoping that the government can support, basically by providing this medication in Bahrain, and also, basically perhaps subsidize or cover for the Parkinson patient, because now with the increased numbers of the Parkinson patient and the current challenges that each and every Parkinson patient is facing with the swallowing and all these challenges associated with the current medication, I think this one that we have been providing for our father has really been helpful and has addressed a lot of challenges that we're facing. Thank you for Dr. Mohammed Al-Mahdi, who is has been really helping us searching, helping us. But I think the ask is to make sure that we provide this for the rest of the patients here in Bahrain. We're here, I think it's called Via Living or
Don't worry, you I think you're taking our jobs. I think you can start a Parkinson's clinic.
Yeah.
That's what we say, empowering patients. So empowering patients, that's what the word of mouth is powerful. Yeah, thank you very much. I can see 2 smiles at the back, Hani and Dai, and Mahdi. Good. So I think I'm getting a pressed questions from Dubai. So we're going to ask the PVOD Council, Parkinson's. Next question from Dubai, please.
Well, actually, this question is from the capital. We have a city in the capital of the UAE. It's called Al Ain. So this question comes from there.
First of all, thank you for streamlining all the questions because the emails are flooding. So thank you very much for streamlining the questions, so one after the other. So thank you very much first for that. Yeah, please. What's the question from our line patient?
I'm trying as much as I can, to put all the questions together so that, we don't ask the same question more than once. The first part of this question was actually asked by the carer right there in Bahrain, but there is a second part of it as well. Now, this carer from Al Ain says that his mom has Parkinson's. She was diagnosed 5 years ago. And the only thing that they get from the doctors is Sinemet. Now, the mother takes Sinemet 6 times a day. And they've heard about new pumps. Can you please explain about the new pump treatment? Over to you, Dr. Vinod.
To the experts, what's the age of the mother? Very important.
She is right now 57.
57, very young onset Parkinson's, Sinemet taking 7 times a day. I will ask Professor Odin, the pumps guru, then I will pass it on.
And remind him that we want to see him the next time when everyone comes to Dubai.
I will be there.
We have a very beautiful city. You're going to like it.
Thank you. Yeah, one advantage with pump treatment is, of course, that you don't have to remember the intake of the tablets. That's right. So if you have many tablets per day, that can be part of the indication for pump treatment. But the main indication is that you have fluctuations in the status, fluctuations in the motor status of the patient, and or dyskinesias over movements. One should ask if the effect in this patient is stable or if there are fluctuations. When there are fluctuations or dyskinesias and 6 tablets per day, that is probably a good thing to think about pump. And which pump is then another thing. It's a difficult choice. We have in many countries now 4 different pumps. You mean which pump?
Yeah, pumps, yeah, basically.
Yeah, well, I think nowadays, we like to do the least invasive things first. So, and we have 2 pump systems, apomorphine and phospholevodopa, that are subcutaneous.
They should come to a moment with our specialist so that that's what I thought. Yeah, exactly.
Yeah.
Patient selection is very important.
Patient selection.
Yes, yes.
Hello, Huzaifa, how are you?
Later, Dossi, how are you? Later,
Okay, I think as Professor Odin said, they have to come to a specialist center There are two main types of pump. The one is for apomorphine infusion, which we have been using in the UK for many, many years, and now Vin has brought to Dubai as well, as you know. And the other one is a very new pump with phospholevodopa. It's a small pump, and these go into the skin. And there's another type of pump, duodopa or lesigon, which goes into the gut. So it depends on the type of patient, the choice. Then you have to make a decision which pump you use.
Professor Ray likes all the pumps, Josefa. But what I would suggest, the question is, what is the best? The patient from online needs to see a movement disorder specialist so that he will decide. Agree, experts? Yes. So, and as almost the carer explained, so how we are changing. She said she's coming all the way to Dubai. She doesn't need to come anymore to Dubai. So she can get the pump in Bahrain. Yeah, you answered all the question. You became a doctor. Yeah. So that's what. So we'll take one more question because there are like 50 of them. Uzefas, the second question, please, from your patient. Streamline. We can't take all 100 questions. Second question.
Of course. Now, actually, this question, the patient says that the patient is waiting for like more than 45 minutes to ask the experts, because it's not so easy to get all the experts in one panel.
So waiting list
Thanks
to see
to
Professor Ray
Bahrain.
is 2 years, Josefa, and me is 12 months in NHS.
Thanks for, I understand. I know it more than anybody else. Thanks to King's College and of course Bahrain Specialist Hospital for getting all the experts on one panel at one time. Now this patient says that he's from Dubai, but his father lives in Saudi Arabia, and they have a question that his father was diagnosed with Parkinson's and talks a lot, and when he sleeps, his mother complains to him that his father talks a lot in sleep and dreams a lot in sleep and shouting as well. And the son, he's far from his father, and he's someone actually that I know personally, and that's the reason I've chosen this question. Sorry about that. Now they have actually changed the doctor as well, and they've changed treatment as well. He wants to bring his father to you, Dr. Vinod, in Dubai. Every time they call you, this is actually, I don't know, should I call it a compliment or should I call it a complaint? I hope Kimberly is there to note this down. They say that there is no appointment for you, Dr. Vinod.
Yeah, I think, so no appointment with Dr. Vinod. We'll discuss this later. So Josefa, fantastic question. I will ask one of the doctors here, who is a carer of Parkinson's. Where is the Bahrain family doctor? Oh, so I want your daughter, who cares for Baba, Parkinson's, what she will do with this patient comes to her first. Yeah, that's so we have a patient, Parkinson's. Say, for example, madam, I got a dream from London. I became a king of Dubai. I can dream what I want, but I'm shouting, I'm a king of Dubai, I'm a king of Dubai. That's pathological. So does your husband talks like this one? Dreams? Ask it, Arabic. Yeah? Yeah, see? Josefa, see? So he also talks.
I don't know, I don't know English too much.
Oh, sorry. Ma.
Now she come.
Okay, fine. So because this is a very important question for the family physicians to identify. Yeah. So, see, doctor, we have a question from a patient from Saudi Arabia. So apparently, mother complaining, his dad is talking in sleep, acting in sleep, pushing and pulling the mother in sleep. Too much. See, your mother is...
My father has this.
Exactly. See, she's saying pushing, pulling. Yeah. There you go, Zephyr. We have a patient live here. Same question. So what would you do as a family physician if anyone comes to you? Don't
I will
refer
check his first.
to King's College Dubai.
I will check his history first.
Yeah, well done.
Medical history, his medications for sure.
Yeah.
As my father case, might
So
be
my
medication
question-
side effects,
my
nightmare
question-
or whatever.
My question is it physiological or pathological? Hitting your mother in sleep.
Physiological more?
Come on,
Oh,
your mother will
pathological.
get to hitting. Hitting is pathological.
Okay.
Yeah, so see, that's very important. Dreaming is physiological. Dream enactments is pathological. So what would you do?
In terms of what you
So
mean?
like,
the
okay,
question?
I will ask one of the experts. Rukmini, do you want to comment on that one? So in a simple layman words, please, and how we treat it.
This is called as RBD, REM sleep behavioral disorder. This can happen before the onset of movements in the hands and the tremors and in Parkinson's disease. So sometimes it can start with that and then it can progress. So the treatment for it is that you can give a couple of medicines. Actually, it is they respond well to either melatonin or to clonazepam, both of which on a lower dose can actually help them quite well. So we would start on melatonin, increase the dose, see if the patient is improving. Otherwise, you go on to clonazepam. RBD is supposed to be one of the the precursors. So suppose if somebody has RBD and they also have a smell abnormality which somebody is planning to do a test, the combination with probably constipation, if this trio is there, then the likelihood that the patient will develop Parkinson's disease is quite high. So that's what I would say. You have to treat it. The other thing that I would just say is that this is very simple, because if the patient has got very severe RBD, a lot of time they can fall down and they can have injuries. So we tell them that make sure that you have some, preventive measures to make sure that they don't fall or the spouse doesn't get hurt.
See, you asked very important questions for that. One is the medication, another one is swallow. So this is very important. You see the reaction of your mom? Doctor is pushing, kicking. Yeah, see, that's the carer reaction. Yeah, so that is pathological. If you don't treat it, he will fall. He thinks his swimming pool and he will fall out of the bed and he broke. So what Dr. Rukmini is saying that this is a pathological condition that's either precedes Parkinson's or it comes as Parkinson's progress. So you need to monitor it. So sometimes melatonin drops will help, sometimes clonazepam. He's a lung specialist. So he's a consultant respiratory physician who works closely with Parkinson's patients. He's going to shed one line whether sometimes they get snoring and all the stuff so that his clinic will be full as well.
Yeah, one of the things is obviously RBD is there. Many of the Parkinson's do have sleep disordered breathing, and they can have periodic limb movement syndrome as well. So this can coexist together. In addition to that, as they were discussing about upper airways, they can have obstructive airways disease, even if they're not smokers. So all this thing can add up. There can be a hypoxic burden that can be partly contributing to certain of the limb movements because of the hypoxia that is going to the brain. So we need to rule out these diseases as well, whether they have obstructive sleep apnea, periodic limb movement disorder. Dreams are a part. People do dream, but again, being pathological and non-pathological, that needs to be looked at. So a good history about their sleeping behavior, ruling out sleep apnea, looking at oropharyngeal clouding, swallowing, which is one of the important things, that will help us to channelize and specifically find out what the cause is. Thank you.
So basically, if the sleep problem coming with snoring, then obviously we need to look, rule out the lung side of things as well. So I think it's clear. The answer is we should treat it. Sometimes if you don't have anything like control release overnight, it gets worse as well. You agree, expert panel, yeah? So we need to make sure Parkinson's medicines needs to be optimized. Then we start treating it with the medication. So we'll ask the third question. I know they're waiting from 6 o'clock.
Sure. Actually, now I have two questions.
Yeah.
I have a lot of questions, but I will just ask about these two questions. The first question is actually something that for sure someone from Bahrain Specialist Hospital would be able to comment about that. that I have someone who says he's right now in Dubai, but from Bahrain. They would like to know what Parkinson's treatments are available in Bahrain. This is the first one. Second is my sister, Dr. Sheikh Al-Mazrou'i, still there?
No, we have other sister Huzaifa. Sheikha, Dr. Sheikha is the chief invitee. She just left. So
The other question was actually for her.
yeah. So Bahrain Specialist Doctors. Anyone here? Abdurrahman. Oh, there you go. So we have a neurologist here, Huzaifa.
Perfect.
Yes.
Perfect.
So, sir, is any question for them or
Actually,
available in Bahrain?
what's available in
Basically, the
Bahrain?
question
What treatments are available in
for
Bahrain?
Parkinson's patients like this. So, patient son works in Dubai, is it? Oh,
No,
patient is in-
the son is actually the son is right now in Dubai for vacation,
Oh, I see.
and will be going back. And he got to know that there is a symposium happening on Parkinson's in Bahrain.
Right.
So he wants to know what treatments for Parkinson's
Basically, what
are available
treatments you have in Bahrain?
The
in
oral
Bahrain.
medications available are Cinemet, in addition to Bramibixol tablet, plus amantadine.
Right.
Those are the oral medications. On the other hand, the subcutaneous medications, Dr. Mahdi, a few days ago or last week, he applied apomorphine injection, available as well, subcutaneous infusion. Yeah, those
Dr.
are the
El-Mahdi is
available.
bringing the device-aided therapies to Bahrain. Well done, Dr. El-Mahdi. One side stroke, one side Parkinson's. You're the superstar.
I'm trying my best. So actually, we don't have enough medications in Bahrain, except for the oral medications. But the newly developed medications, it's not actually so new, even apomorphine and Vialev. So we are trying to integrate them into the governmental sector. This is why we invited all those chief invitees to this event to facilitate the presence of the high-value medication or high-quality medication for the Parkinsonian patients.
Right, excellent. So Huzaifa, basically, they have a standard treatment care. So the pumps are now it's coming up through the Center of Excellence, so it will be more available. So I think the doctor has also explained. So I think we'll take a second question, Huzaifa.
Sure.
Oh, 1 second. We will give the floor. 1 second, Huzaifa. Beg your pardon. One question from
No worries,
the
no
in-house patient.
Sure.
I'm sorry, I'm a doctor.
Oh, please. Sorry, madam.
I just wanted to, I was listening to the patient who was here. He was complaining of postural hypotension.
Yes.
And he seemed to be walking okay. So I was wondering whether patients like this, will sport help them in maintaining their blood pressure? Because it's a movement disorder after all. So would you attack it with exercises or having group therapy with movement or some kind of light sport that they can handle, even a very simple thing?
Right, okay. So I think you're a very good observer, doctor. What sort of doctor? Family physician?
Sorry, I'm an orthopedic surgeon.
Oh, wow.
And
wow. There's a double wow. Yeah, right, okay. For orthopedic surgeon, I think Professor Ray will say.
Hi, very nice question. So one thing to be careful about is what is causing the postural hypotension. If it's drug-induced, what you're saying is actually relevant. But if it's disease-related, in other words, dysautonomia, then exercise can make the blood pressure go even lower. So it's called exercise-induced hypotension. It's quite a well-known entity. So you have to be quite careful about the type of exercise. But generally speaking, exercise is recommended in Parkinson. We say 150 minutes a week for all. Physical activity. You don't have to wear leotards and do weights in gym. Any sort of exercise, even small amount of exercise, like walking from here to there for 10 minutes. I call it exercise snacks. As long as it becomes 150 minutes a week. That's the mantra. 150 minutes a week.
I'll just add to the exercise. So it is well known during the exercise the blood pressure go down because of the autonomic dysfunction. And even after the exercise, post-exercise hypotension can remain there for hours. So there are two different types of hypotension which are induced by the exercise. So dysautonomia means exercise-induced plus post-exercise hypotension. Not only this, even postprandial hypotension is again a dysautonomia. After breakfast, after lunch, after dinner, blood pressure can drop down if your autonomic dysfunction is there. So obviously you have to be very vigilant whether the postural hypotension is because of the dysautonomia or it is because of the drug-induced, whether it is physiological, normal dipping, what are the levels, and that is why we ask for 24-hour ambulatory BP monitoring.
We take your number. We'll invite you to all over, so that because 40% of patients we see in Dubai are misdiagnosed as knee replacements, shoulder replacements. I'm sorry to say that. And that's what orthopedic doctors needs to understand. So that's very basic. It's a very important question you ask. Is it a exercise induced or is it a disease progression? Well, thank you very much. I hope it's clear. Thank you. Very good.
Thank you so much.
No worries, doctor. Thanks for coming and asking the
Thank
question. Huzaifa, I think Ahmad is here. Huzaifa asked a question. A patient asked a question. Every time they ring for doctor, for Parkinson's appointment, call center is saying that booked. Yeah, please highlight that one. Yeah, Huzaifa, Ahmad is here. That's why I called him. Next question, please.
Thank you. I
You okay, Asna?
have a question here from a patient that says, the patient is actually YOPD and someone who lives in Dubai and asks the same question that I asked Professor Ray at one point of time. Why me?
Okay.
And is King's Dubai doing any research when it comes to curing or looking for a cure for Parkinson's disease?
Thank you, Huzaifa. I'll keep it very short. The question is a patient diagnosed with young onset Parkinson's, YOPD. So sometimes we see, especially in Arabs, we're seeing a very 30-year-old Parkinson's. You see that. So they're asking, is it normal, abnormal, or is it because Rukmini can answer this question? She's doing a lot of, I know Professor Ray, but I'll give, because you're involved in YOPD genetics, Huzaifa, then that's your baby.
So it's a difficult question. So whenever you have a patient who's got young onset Parkinson's disease, we think that there's a genetic mediated component. A lot of patients in India who have young onset Parkinson's disease have what we call as autosomal recessive disorder, where if the parents are related, they have one allele of both the genes and the patient gets it. So we have a lot of Parkin and PINK1 mutation. So we have done a research on young onset Parkinson's disease, around 1,000 patients in India, and have looked at how it is, what are the genes that we have commonly seen. And I think, Dr. Vinod Mehta is actually doing a genetic study for patients in Dubai. So that's a research which is ongoing. Cure for Parkinson's disease, the idea of getting a genetic basis is that probably if you have a gene which is present and you understand how the pathophysiology acts in, you can probably target some molecule in it. So a molecule which had come in, which was a tyrosine kinase inhibitor, has been thought that it may work in LRRK2 as well as Parkin mutation. That was a nilotinib molecule. Again, congeners have come in. But the other option is also to have a single gene therapy which probably can target the gene, or have a ASO later on.
So that's question quite often pops up. Why me? Why me means why Parkinson's at the age of 30, 35. It's very daunting to see anyone with Parkinson's at the age of 30. If you see your brothers, sisters, but the answer is, it's not a knee replacement, madam, to correct it. So I think, a lot of research going on, and hopefully, Huzaifa, we're going to find an answer. So we'll take, Huzaifa, we'll take another 3 questions, Huzaifa. Then we'll do another one in Dubai next month or month after. So we take another last 3 questions.
I want it to be next month, actually.
Yeah, we will do.
It's been a quite long time.
Therefore, to bring all these legends, I need to sell my kidneys. Yeah, we'll take next question.
Sure. Now, a person says, my grandfather has Parkinson's. The main problem is falling. He falls a lot.
Yeah.
And they're confused every time they go, the doctor increases tablets. And they would like to know, is increase in tablet causing falls or is it Parkinson's?
I will ask the expert in falls, the Professor Goyal. So we'll keep it very simple. A patient, how many
Okay.
years Parkinson's is it, Josefa? I know you don't get all the questions. How many years of Parkinson's is it? Early
It's
stage, late?
7 years. 7 years.
So 7 years old, 70-year-old patient, recurrent falls. Is it a disease related, medication related, or
The question, yeah, the question is actually asked by his grandson.
Oh, thank you for the question. It is important to know when the fall started, whether it started with the development of Parkinson or after 7 years of illness he has started having fall. So some of the reason I find the commonest reason I would look at the knees first. We're keeping in mind the old age, if the knees are giving trouble.
Orthopedic surgeon, is it?
Yes.
Yes, there you go, there you go.
I think 8 out of 10 patients are falling because of
Where
the
do
knee
you work,
problem.
madam? Where do you work?
Second thing I need, whether it is related to drug. When there is an off time they fall or when there is an on time they fall. Sometimes they fall on time because of the dyskinesia. So they lose their balance and fall. And off time means they don't have the adequate effect and then they fall. So we need to know exactly.
Basically, three things. Is it mechanical? Refer to orthopedic surgeons. Yeah. So it's a mechanical, refer to orthopedic surgeons. If it is a disease related, so we need to optimize Parkinson's, it's the off falls. If it's a medication related, dyskinesias, we need to, if it's 10 tablets, device-aided therapies. So we need to optimize the falls. Yeah, postural hypertension, I think we are. So I think we got a good discussion about it. Thank you, Dr. Goyal. Is there for next one, please?
Sure.
take
Someone
two more.
says, sure, his father was recommended some sort of whole surgery in the brain, which is actually, as all of you are aware, the expert panel, they're talking about the deep brain stimulation. They're scared. Is there any treatment, any side effects for this treatment, or is it safe, or should they opt for something else?
So basically, Cleveland Hospital asked him to go for a deep brain surgery. They're going for it to make you happy, Rupan. But they want to know whether there's any side effects or you give 100% guarantee and warranty.
No, I don't think anybody can give a 100% guarantee that if you cross the road 100 times, you won't get struck down by a car in India. But that happens anyway. So the point is not 100% guarantee. The point is the efficacy. What is the outcome? No, I'm telling the side effects. There's been a head-to-head comparison between the best medical therapy and DBS, patients treated with BBS. The side effects in the form of falls were more. But and every other parameter was, if it was motor improvement, whether it was quality of life, whether it was a reduction in drugs, all this was much better with DBS. So the comparison between the two was done in 2014. It was called the early STIM trial. It was published in NEJM quite a long time back. So all this is clearly there, and that was where gave the great impetus to DBS. DBS is not 100% safe. It is not 100% safe. Oh, 1 minute, I'm just getting to that. The most dramatic one is that you can get a bleed during surgery and it can be fatal, and it is about 0.3% fatality, and small bleeds to big size bleeds is around 6%. But it's much less now. People have got using much smaller micro electrodes, the procedures faster, techniques have got better. So the bleeds have come down markedly in well-established centers. It's the newer centers that you can still have bleeds. So if you get it done in a well-established center, I don't think it should be a problem from that point of view. The other one is infections. Infections were supposed to be at the rate of 5%, but it's come down markedly now. So long-standing implants, you can develop infections at the site of the battery, at the site of the connecting wires, and that can always be treated either by explanting or and reimplanting or trying to control with antibiotics, all of which is done. Other side effects include behavioral changes, transient. It can include a few other changes, but they can be managed well. So,
basically skill has
yeah,
side effects.
correct. And secondly, it is the treatment of choice.
So to summarize, I think it's education for us as well. I think so. You want to talk? Yeah.
Thank you.
Yeah, please, sir. Go on.
Is anyone saying something?
Yes, sir, for 1 second. The Bahrain neurologist wants to comment.
Okay.
Yeah. Yes. Yeah. See, I think I'll open up a debate for one thing. Position sense, it's more peripheral. I don't think. So you're talking about joint position or postural instability?
Loss of positional sensation at Parkinson's patient.
Yeah.
That's why he's losing his balance and fall. Definitely, we should rule out any other possibilities like knees, osteoarthritis, or whatever. But one of its manifestation is loss of positional sensation. So what I am telling my patient in order to improve this imbalance is to use a stick in which a way they can increase the positional sensation inputs to the brain instead of relying on only their feet.
Yeah.
By using a stick only hitting the floor, you can giving more signals to the brain and enhance the positional.
Yeah. I think you need a physiotherapist like Serene sitting there as well.
So no, I would like to hear from you, expert gentlemen and ladies.
This is a good question. Actually, the general neurologist, movement disorder specialist. See, you're using the word joint position. That's a complete different columns. So Parkinson's, it's mainly a central problem, unless your patient has superimposed like diabetes, peripheral neuropathy. So Parkinson's per se, doesn't give you unless you have a superimposed Asian, Indian, Pakistani genetics, then they get a bit of a dorsal column loss, the peripherals. So the Rombergs and all the stuff will, that's more of a peripheral neuropathy. So EMG, EEGs, nerve conduction studies will help you to rule it out. But what we see in Parkinson's is not peripheral. It's more central. Yeah. So dorsal columns first, unless it's a peripheral neuropathy, then we don't need to, it's not mainly the pathophysiology of that. So you all, Carolina?
I just have a comment about the patient selection, because we all know that DBS infusions are super effective method of treatment, but sometimes they are not good for one patient. So for example, when we're thinking about deep brain stimulation, maybe it will be not the best choice when patient has severe dysarthria or postural instability, on-related freezing or on-related falls. So when levodopa working, but patient still has falls, because generally speaking, DBS can deteriorate this type of problem. It's very good for dyskinesia, tremor, fluctuation. So we have to be very careful when we want to choose the best method of treatment. Right patient, right treatment, yeah. Very individual.
See, what was actually included initially as exclusion criteria included axial symptoms, swallowing, dysarthria. This is 20 years back. Gait problems. We are not supposed to take these patients up for surgery, but we see more and more camptocormia, that these patients get better. What does, as she said very rightly, on symptoms, if you are falling, that may not get better. Whatever is in the off symptom, if you are falling, those are because of postural imbalance, not positional. Postural, the term is postural because you do the pull test, you see them falling back on you. So they get better. The postural imbalance gets better, the gait freezing gets better. And surprisingly, even some patients who have freezing in the on get better, but you don't guarantee them that they will get better. The off will definitely get better, off may not, on may or may not. So some symptoms do get better, some do get worse.
Basically, what I do in my clinic, if they're falling in, so just a neurologist. In England, we are very poor. We don't have money. We don't have petrol in UK. We're all bankrupt at the moment. So we don't have luxury of doing all this tests. I rely on my clinical examination. Say, number one, is it a spinothalamic tracts or just a dorsal columns? That's just, if you have a good distal intact dorsal columns, then it's coming from central. Then you do the postural test, a retropulsion test. That gives an answer. Another 40% are superimposed NPH. So you need to make sure that's I'm seeing. Actually, we're writing a paper looking at all last 400 patients. So we're just looking at how many patients has normal hydrocephalus. Asna nowadays is becoming very busy. So that's why, we are busy with Ramadan guidelines, and we're going to look into it. Then we go at, complementary nerve conduction studies. Yeah, see, I'm not sure how super duper doctors you have here, nerve conduction studies like Rupam and all the stuff. But what we get is mild neuropathy, clinical correlation, mild neuropathy, clinical correlation. Yeah, everything is normal. Why patient abnormal? So it's so I don't blame just a peripheral one, but you need to screen NPH. That's I'm seeing 40%, right? Rupam.
The other thing is that, for people in India who are vegetarians, levodopa actually can reduce the absorption of B12. So you can have an added B12 deficiency, which also can add on to the...
Normally B12 will be normal, homocysteine and MMA. So that's what you need to the precursors of B12. That's what you should do.
So talking about NPH, we have just recently described for the first time in the world delayed NPH after DBS, many years later, 10 years, 12 years later. And why is this important is that these patients are falling again after many years of DBS. You think it's progression of the disease. No, it's a treatable condition. NPH by itself in PD is not common. It's very, very uncommon. You do get NPH with PD-like symptoms from the scratch. So that's what I'm saying. No, I'm just clarifying for him. So that can happen, but you need to sort it out.
Tomorrow we have an academic debate, full sessions. We will fight tomorrow.
Yes.
Yeah, we'll prepare for questions for Rupam. I think patients they can't wait for the medicines and food. Uzefa, we'll take one more question. I know you have lots. We will do another session next month. We'll take one more question, Uzefa. Please.
All right. Okay. Actually, there are two questions. I'll just keep them out to you at once together.
All right, okay.
The first one is actually from
one
Fujairah.
after the other, Uzefa. One after the other. Here's okay, fine.
All right. Now, these both questions are actually important, and I really don't want to miss them.
Thank you.
Because these patients have really been waiting for all the experts to be together, and this does not happen.
Sorry
So
about that,
we
Uzefa.
really want to,
Yeah. Please.
This question is actually from Fujairah, that this Parkinson's patient has Parkinson's since last 10 years, and she has lost 10 kilos from her weight. The tablets that she takes, because the tablets are a lot and she feels fed up, can any new treatments help her to gain weight or not?
Okay. So any other question, Uzefa? That's it. Weight loss?
Yes.
Yeah, right.
We have one last question.
Yeah, please.
This question is actually
Still, I
for
can see
you,
all
Dr.
patients on
Vinod.
Zoom, yeah. They're watching.
This one question is actually for you, and I'm not sure if somebody is there from King's team. I'm sure your team is always there with you. You don't go home early, and you give a hard time to your team as well.
Asna still smiling, and still the makeup is not still there. Yeah, still despite she's working hard since morning. Yeah.
Yes, that's why the patients, they love you so much because you're very close to their heart. The question says that
Now,
this
Professor Ray is
person
becoming
works.
very close to the patient's hearts as well, Uzefa. I'm seeing him last
He
3
is
months,
already.
especially Bahrain
Yes.
Royal Family. Yes.
Now, this person says that he works in Dubai. His father has Parkinson's, and it's good to see all the world, experts together at the same time. And would like to thank King's College and Bahrain Specialty Hospital for getting all of them together at one stage. The question is actually for you. Now, this person wants to get his father travel to Dubai to get treated from you. and to have a pump for his father, and would like to know how much does this pump cost. He got a great feedback from one of professors who underwent a treatment under you. I'm sure you might be knowing that more than me. If you can comment on that, please.
Yeah, Ziffer, first, very important first question. The second question is, first, see, I think, see, what you can see, sir, here, very relevant questions, right, what patients are asking. So these are the questions comes to us in the clinic. So that's what, so first one, weight loss. So therefore I will ask, so we have a gastroenterologist, Professor Guy Chung-Fei here. He's getting ready for the evening. And we have Rukmini as well, so weight loss is multifactorial. Guy will shed 3 causes of acute chronic weight loss. Guy.
Dr. Guy, before you answer the question, I would like to say one thing. Everybody gets old except you. You get young every day. Please, a round of applause for Dr. Guy.
One day I'll share the secret with you, Josefa. Thank you very much. Really important question. Yes, as you said, there's multifactorial causes. I think the first thing is to get a proper assessment of the patient. Are they having an adequate dietary intake of calories? And can do that with the help of dietitian to make sure that they're eating well, they're chewing well, they don't have problems with the swallowing, as we've heard. And are they getting enough calories on board for their body weight and age? The second thing, I think, is to see if there is any underlying treatment you can offer. If people have, say, problems with swallowing, use of thickened feeds, increasing the calorie intake by use of nutritious supplements like 40 sips and inches. And the third thing, the important thing, is because these patients are generally older, you need to exclude a pathological cause such as cancer or other diseases. So you need a full proper assessment to see where the weight loss is coming from. But I think, so really need to see a specialist and make a proper assessment and exclude any serious other cause of weight loss other than the Parkinson's or dietary cause.
There is a real swallow problem, and we can always do if there is a real swallow problem, with a swallow and weight loss, say, it's my personal choice, Rupam. You agree or don't disagree, we'll do it tomorrow. If I see a patient with a weight loss, say it's more than unintentional weight loss, like a stone or 10 kilos or 2 stone, then I always counsel patient. Number one, they're already on 10 tablets. I counsel them. I would give them option of intrajejunal levodopa infusion. The reason why I give intrajejunal levodopa infusion is you can give calories and dopamine. Yeah, so that's my always I explain, and I try to convince 70-80% patients are very happy. That's why I love that one because none of the other treatments will really psychologically they have a pump, but physically that they lose weight. Psychologically they lose weight, and physically they lose weight. So I always give intrajejunal levodopa infusion. We can give 1,500 calories. Still they can eat orally. Then instead of 20 tablets, we can nicely, I always say to my patients, as you know, if you want to go to London airport, Dubai airport, would you be happy going Dubai traffic jam or a flyover? So they say flyover, then the team will start doing so that's what I always recommend. And you see the difference within 3 months. Agree, Professor Chaudhuri, do you want to comment on that one, weight loss, advanced Parkinson's disease?
No, I think, as has been said, I think the important thing for the patient to remember, all that happens in Parkinson's is not due to Parkinson. So as Dr. Guy said, rule out other causes, although it's 10 years unlikely to be sort of malignant issues, rule out other causes. Vitamin deficiency also, malabsorption, all of these things can happen in Parkinson's. So ruling out other causes and then build up good nutrition. That is really the answer. And apomorphine as such is not really useful for weight loss. It's very important to know that we also know that there is a subgroup of Parkinson's who lose weight. That is known as Park weight subtype. It's been well described, but for that assessment you need to come to see Dr. Mehta.
See, All will get love and affection. Finally, Uzefa, Sampath, do you want to comment on what would you do if a patient, honest answer, 65-year-old man, like patients like him, weight loss, losing weight loss, guy done all the gastro all over. So then would you give more love and affection, or you do more calories you can't, or you want to go with a device-aided therapy? No, honest answer. So just what is the initial device-aided therapy? What is the definite?
No, basically reassure the patient.
Yeah, we
it's
always
not
do that
because
in
of
England. We was in England, we do
Parkinson's. It's not
reassurance.
because of Parkinson's. Some other factors operating. Then if it is more severely disabling, I think advice go for your therapies, non-oral therapies. Therapies, which is the best, I think.
No, just one comment. I mean, some of the medications like especially cephinamide can cause significant weight loss. So you can just check whether you're on cephinamide and the patient has been. Amantadine also can cause weight loss, so some amount. But cephinamide has been shown to have.
I'm seeing the Bahrain prescription sometime, apart from Dr. Elmadi's prescription. I'm just joking. So they do amantadine, sulfonamide. Amantadine, I'm seeing some prescriptions, 300 milligrams, 400 milligrams. Then it can cause hallucinations. Amantadine, 400 yeah. And sulfonamide, 100 BD. Yeah, so that's why, it's a drug-induced, that's why what I do is I'll optimize those treatments. Yeah. So I think we have a fantastic session tomorrow. So from everything, so that you can see what's the updated guideline says. So Huzefa, I know I'm sorry to keep all the patients waiting. Huzefa, I know I'm getting tested. Do you have? So do you want us to take one more question, or we can do the?
I think, Doctor, it's better. We're really looking forward to have the next session in Dubai.
Yeah.
I'm looking forward to having you back in Dubai
We
so
have
that we
Professor
can.
Odin in our sleeve now. Mostly you said like you should the Dubai. See, let me explain.
Exactly.
Let me explain to Professor Odin. It's the first time we're doing it. Sir, what we do, Professor Odin, Huzefa is Parkinson's association. So we work very closely with people of determination. That's the biggest support group, government group. Those people who can't afford. So to see me in Bahrain, Dubai, they charge 1,600 dirhams, yeah? And the MDT clinic is 2,500 dirhams. That means almost 800 pounds. Yeah, if Prof. Chaudhuri is in good mood, the 20 minutes. If someone else with him, 5 minutes. So then what we do, all these poor patients, we, Ray and Doi and Guy, we just, say that rather than they coming to us, we go to, Huzefa is great. 1 month we do in Dubai Police Academy, once on Dubai ambulance, and we do in different venues. And we just go there, chat with them, sit with them, and so you can see how many enthusiastic. So there's at least an awareness. Even a family physician like this, do you think it's a good initiative, madam? Yes, so that, we get that touch with the patients, that, we are not gods. So they have interactive session. So I think I need to thank Huzefa for doing this continuously for 5 years. And we are now like 1,500 patients. And Cleveland, Huzefa, yeah, so no more American mafia, no patients.
Thank you, Huzefa, for being with us. We would have loved also that we see you here in Bahrain. Actually, I asked for that, and I knew that you were arranging from your side there in Dubai. So we need to.
Conclude.
We need to get your help to initiate our society here, patient society, with Hikmat and the caregivers and Parkinson carers. We will go through your experience to establish similar thing here in Bahrain. So we'll invite you soon to be with us here and to show this excellent societal achievement in Bahrain to the authorities, so that we are able to get them medications, we are able to help the patients as much as we can. Thank you, Huzefa.
Dr. Mohammed, thank you so much for your kind words. there is one thing that I would like to conclude by saying thank you for your invitation. Hikmat got in touch with me, but unfortunately I couldn't join there. Thanks to Bahrain Specialist Hospital and also to King's for arranging the symposium there in Bahrain. I'm really looking forward to seeing you, inshallah, very soon. I would like to just tell you one thing. Actually, the direction that we are moving on to right now here in the United Arab Emirates is what the government of, or what the wise leadership of the United Arab Emirates wants us to do. They believe that, you know, the people of determination, they should be empowered. That's the reason, alhamdulillah, and I would like to thank the expert panel and a special thanks to Dr. Vinod for actually translating the views and the ideas to research papers and for giving it as, I would say, guidance to the whole world, something that, you know, will make us proud, something that will make the United Arab Emirates proud.
You have steps that you have already done in Dubai, and you want to follow through these steps rapidly. Bahrain is a small country, and everything is achievable here. Thank you, Huzaifa, for your comments.
I am with you. I am with you, as we say in Arabic, قلبا وقالبا, inshallah.
Merci, thank you, Huzaifa. I would like
يعطيك العافية دكتور
to
محمد.
thank all the expert panel for their guidance and their reply for the patients and patient carers. I would like to thank Dr. Vinod for his amazing support to the establishment of this communication here. Thank you, Vinod. And inshallah, we would be happy to establish this all over the Gulf region, actually. Thank you for the team of King's College London and for the pharma who supported our program. And we hope to see you again. And I think all of you now are hungry, so we would proceed to have something to eat. Hasna is
بالعافية.
with the manjaro. Thank you.
دكتور قل لهم بالعافية. Thank you, Dr. Vinod. Thank you, everybody. It was a pleasure seeing you all. Thank you. Bye-bye.
Recording stopped.